What's up, everyone? It's Tatiana, your favorite surgical technologist, and I am back, guys. I know I was gone for a minute, longer than a minute, but I'm back. Today, we're just gonna get into just the basics. We're going to be talking about something that is actually super simple, and I don't know why maybe it wasn't my first video, but what exactly it is to be a surgical tech, because not a lot of people know at all. So like I was saying, not everyone really understands what a surgical tech is. Even if you were to Google it, hold on, let me tell you the exact Google definition of a surgical technologist. A surgical technologist, also called a scrub tech, a surgical technician, or operating room technician, is an allied health professional working as part of a team delivering surgical care. Surgical technologists are members of the surgical team. No shit, Sherlock. You can't use surgical in the definition of a surgical technologist. It just doesn't make any sense. It's obvious. It's a given we're part of the surgical team. It's a given that we're part of the whole, shebang when you get into the OR. But what exactly is it that we do? Now, one thing I want to start off by saying, we as surgical techs are not nurses. We work very closely with nurses, but we are not nurses, okay? Nurses can be trained to scrub like a surgical tech, but that's not even something that they learn coming right out of school. That is its own unique skill / trade, all right? Let's not get that twisted. As a surgical tech, we're usually the first ones in the room in the morning to make sure the room is set up and ready to go for the specific specialized surgery. So every surgery specialty is different. So if you're doing cardiac for hearts, that setup is going to be different from an ortho room if you're getting like your bones fixed, which is going to be different from an ENT room, like if you have ears, nose, and throat. It's going to be different from a plastics room if you're getting plastic surgery, breast augmentation or a tummy tuck or anything along those lines. Every single specialty for the room is going to be set up differently. So as a surgical technologist, the first thing we do is get into our rooms in the morning and make sure that our room is ready to go. Another thing that we do is make sure that the specialty specific instruments are ready for our case. All right. You can't do delicate vascular surgery with orthopedic instruments. It doesn't work. Those two do not go together. Okay. So we want to make sure that we get the specific instruments, and trust me, there are hundreds of thousands of instruments. And that's something that we also learn in school. We have to know the difference between instruments for every specialty, especially if you work in a large trauma center and you work in the main OR. You need to know what instruments are used for different procedures. In addition to instruments, we also have to make sure we have the specialty-specific supplies for our surgeries as well. Everything is very specific to each specialty, as you keep hearing me repeat. But we have to make sure all of that stuff is in our room, ready to go, just in case we need it. It's very important. I'm very used to very high stress, very sick patients, very difficult, complex cases. So I always have everything that I might need in my room or close by, just in case shit hits the fan. We're good, which I feel like everyone should get in the habit of doing that. But because my initial training straight out of school was cardiac vascular transplant and a lot of things where shit hits the fan very often, I'm used to having everything ready to go just in case. Now, in addition to instruments and supplies, as surgical techs, we should also know the equipment that we will be using in our cases. Now, we need to know how to use saws, whether you're doing an orthopedic case or you're doing an open heart case. I keep saying ortho and heart and cardiac. It's funny because they're like the complete opposites. But yeah, you need saws in both of those. You need a sternal saw to open the chest. You may need a saw to do an amputation. You'll need a saw and a drill to do a hip replacement. So you need to know the different equipment that you're going to be using. A suction irrigator, which is going to suction up fluid as it's also pushing out fluid to make sure the area is clear that you're working in. Now, the most important part of our job is making sure that everything that we open and use for the surgery is sterile. That is huge, because if the instruments, supplies, everything that we use on the field, if it's not sterile, the patient is at a huge risk for infection, which we do not want, because number one, we don't want the patient suffering from an infection. Number two, if the patient gets a hospital-acquired infection, now the hospital pays for that. The patient, that's not coming out the patient's pocket. So, not number one, it is a money thing, but first and foremost, number one, we want to make sure the patient leaves the OR better than when they came in the OR, okay? Now, something that not everyone understands is that as surgical technologists, we are actually scrubbed into a surgery in our gowns and gloves and protective eyewear and masks. We're actually scrubbed into the surgery, assisting during the case. Yes, I know everyone watches Grey's Anatomy, and every time someone asks, well, what do you do? And I'm just like, the nurse that passes instruments, that's me. That's kind of like my quick way of dumbing it down for people, not having to go into depth. But it's so much more than that. Yes, I pass instruments, definitely. But I also retract. I also help to make sure that the field is clear. As surgical techs, we're kind of the surgeon's third and fourth eyes, because sometimes as they're focused on one thing, there may be something else going on that they may not notice at that moment. And as surgical techs, we have the knowledge to be able to tell when something's not 100% right. So say if one side of the field where the surgeon is focused on, there's bleeding, but you notice on the other side of the field, there's bleeding as well, maybe a little bit more significant. You want to make sure you let the surgeon know what's going on that other side as well. So you don't want to be completely clueless and not open your mouth because he's fixing one thing that may be minor, but there may be something else that's even worse, that if you wait too long or you hold your tongue or you don't know what's going on, that could be a problem. Oftentimes, it's just myself and the surgeon scrubbed into the actual case. The nurses that are in the room are actually kind of like our runners. I don't want to make it sound like I'm belittling their position, because I'm not at all. I need my nurses, my circulator in my room. But they're kind of like a runner that's not sterile. So anything we might need during the procedure, we need sterilely open, our nurse is going to get that for us. If we need a medication on the field, our nurse is going to get that for us. If we need anything sterilely, or even if we just need anything at all, our nurse is there to help us, while us, the surgical tech, the surgeon, or whatever other staff is scrubbed into the case can stay sterile and take care of the patient at that moment. Oftentimes, it's literally just myself and the surgeon scrubbed into the case. And yes, there are some procedures that a surgeon can do on their own with no help. There's definitely those procedures out there. But oftentimes, there's also procedures where they need an extra hand or two. So I'll be assisting. I'll have my forceps down, helping, maybe tapping his forceps to bovie something, passing him a tie to tie off a bleeder. We're actually involved during these cases. I don't want anyone watching this video, especially if you're thinking of getting into the field, to think that being a surgical tech is just as easy as passing whatever instrument the doctor asks for whenever he's ready for it. Because honestly, a lot of the time, being a mind reader is part of our job description as well. There's times where I just look to see what's going on, and surgeon doesn't have to ask for anything, literally just puts his hand out and I know what he needs. We are actually involved. So when you're learning your anatomy and physiology, take advantage of it. When you're learning your med terms, know what they're talking about, because you can literally just listen. Sometimes there's two surgeons scrubbed in, maybe there's a surgeon and a med student, surgeon and a resident. If you listen to those conversations and you know your medical terminology, you can easily pick up on what's going to happen the next half of the case, or what's the next steps of the procedure if you're just paying attention. And You can't do that if you think that being a surgical technologist is as easy as just passing whatever he wants when he asks for it, or she. We are the patient's advocate while they are under anesthesia. If you see something, say something, always. Whether you are a timid person and you're just learning to get out of your shell, if you see something, always say something. Because like I said, the patient is sleeping under anesthesia, sometimes paralyzed by medication, which can be reversed. And they have no idea what's going on. And we are their advocates. Surgeons are humans. And that's why we have a surgical team during a procedure. I like to refer to us as our surgeon's right-hand man or woman because they depend on us. They depend on us to know what's going on. They depend on us to be an advocate for the patient. They depend on us to be their third and fourth eyes. They depend on us to help. They depend on us because they can't do it all on their own. And working in the medical field, working in the OR, everyone should know that we are a team and we all lean on each other. I have never seen a surgeon walk in a room, set up his own case, do pre-op on the patient, give patient anesthesia, do the procedure, put dressings on the patient after the case is over, wake the patient up from anesthesia, reverse anesthesia, take the patient to PACU. Like, it just doesn't happen ever. We are a team, a well-oiled team, luckily, most of the time. If you're thinking about becoming a surgical technologist and taking that leap and getting into the field, take it serious while you're in school. That's one thing my instructor always drilled in us. Take it serious while you're learning, so you will take it serious when you're in the field and it's second nature. And if you're watching this video to understand better what surgical technologists do, I hope that broke it all down and explained it to you. If you're watching this video to understand who's gonna be in the room with you during your next procedure, we're right there with the surgeon helping you, and we're gonna be your advocate. So I hope that cleared up any questions. If you have any other questions, go ahead, leave a comment below. I want you guys to go ahead and smash that subscribe button, smash that like button, and also head over to my Instagram page, _for_the_love_of_surgery. Follow me, repost, get the word out about this lovely field of surgical technology, because when I tell you, there are a lot of jobs out there and there's not enough surgical technologists. And even though I'm a traveler, I can't do it all. I hope that cleared some things up and answered some questions that you might have had. I hope that gave you guys some clarity. And until next time, peace.